Kubor ka Batisi TV. Lawan Rashapi da ka Frank Motors. I am Tata Punch. Price starting at 5.80 lakhs. Ringkat bat ka net foodish. Ordar mapi nginwan ra amangi hakir dobyeng jongpi.
Noilam kaliang persya Dr. Mukul sangma hakar pesau trek nailur arajar arpuar ulah Hiar Jurip ya ka Community Health Center kepada nak senang Mawkyrwat bat ya ka hospital basis Pak Jingthiah ka bampat sim latrai pendap haduk kini kisngi. Hakini ke Jurip ya Dr. Mukul sangma lasan ranlang da DMHO ka Southwest Khasiat District Dr. FL Lartang MDHO Dr. WL Nari lambat kiwede ki doktor bat ki noilam jok ka Trinamool Congress.
Secondary used to be.
Yeah. Only for first term. Provided the first term.
MBS is not under this. I think only those that came before we are paying. I think now is not there. MBS. Before it was maternal
Benefit scheme. And you getting all the medicines? You have to buy or our this support for the.
That's what
No, there's another one that institutional. What is the support you provide?
from
CHC as well as the this new 100-bedded hospital. It's an irony that the project which was sanctioned in 2011 is still yet to be operational. I'll be glad to see if this is operationalized immediately, because 2011 and this is 22, quite long time. But the infrastructure that has been created is definitely something which will benefit the people of the district. And challenge will always be there to have all the specialists in place. We definitely have the huge gap between demand and supply in respect of the manpower, whether it is in terms of general doctor or the specialist. Hopefully, these concerns will be addressed over a period of time. That's precisely the reason why we were working hard to have our medical college, the state's own medical college. Let's see how fast we can see this hospital operationalized. And we are seeing this CHC, almost all the beds are occupied. That's I must say, it's something which is encouraging, because it has always been difficult to convince our people to have institutional delivery. Here we see lots of institutional delivery happening, and it definitely reflects people's willingness to get access to our existing healthcare system. I also interacted with DMNHO and other medical and health officers here. They are very effectively utilizing the benefit of mega health insurance scheme, and that is another thing which I would like to place on record my sense of deep appreciation.
Since 2014, our country has been plagued by divisive forces. TMC is in Meghalaya with the mission to empower the people, uphold the ethnic cultures and traditions, celebrate the sacred land. To urge the proxy BJP government from Meghalaya, be the change, support TMC by calling on 96877 96877.